line on mute throughout the presentation. We can mute you if you'd like to raise your hand and ask a question later on throughout the presentation, and we'll let you know when to do that. But we have plenty of time set aside to take your questions, so we welcome you to submit them throughout the presentation at your question pane on the right of your screen. You can type them away, and I'll read your questions for our presenter to answer. And please feel free also to send me a message via either the questions pane or the chat pane if you're having any technical issues, and I'll do my best to assist you. We're sending all webinar participants a link to the recording of today's webinar, along with the slides and any additional materials that we reference throughout the webinar. So without ado, I'd like to introduce our content expert of the day, so Cindy McElhaney, who joined Q-Corp in 2011 as a senior healthcare analyst. Her focus is on performance metrics, including from consultation and validation for the Coordinated Care Organization performance metrics developed by the Oregon Health Authority. With more years of experience analyzing administrative claims data in her roles at a variety of health plans, Cindy works with analysts to ensure Q-Corp measurement and reporting is both accurate and relevant to various stakeholder audiences. She has a bachelor's degree in mathematical sciences with a concentration in data science and statistics from Oregon State University. Outside, Cindy enjoys snowshoeing and walking, the latter so much that she participates in Portland to Coast Relay Walk each year. So welcome, Cindy.
Hi there. I would also add that I'm actually very sore, very tired from snowshoeing this last weekend. So if I'm not off on you, I apologize in advance. So before we get started in talking about our measure for today, which is chlamydia screening, I thought I would give you a little bit of overview of Q-Corp for those of you who are not familiar with us. We just celebrated our 15th anniversary. We are an independent nonprofit organization that's dedicated to improving the quality and affordability of healthcare in Oregon. So how we do this, step one slide down. This is something that is kind of the core of how we do our work. Is we really believe in the multi-stakeholder approach. What this means is that in addition to the usual suspects when you're talking about healthcare, which are, the providers and the health plans and some of the other people, we try to pull in other stakeholders in the community to inform what we do as far as what's relevant, what's useful, what's helpful for improving the quality and reducing costs in this state. We do that. We have like 4 key strategies for producing neutral information, such as the chlamydia screening measures we report. The first thing we did is we created a huge database. It was initially started in 2007 with 8 of the largest commercial health plans in the state contributing data to us. Since that time, we have moved up. We have 16 data suppliers now. One of those data suppliers is the Oregon Health Authority, sends us all of their Medicaid data. We are also what's called a qualified entity through CMS, which allows us to get Medicare fee-for-service claims from the government, and that's included in our database. Right now, our database with our most recent statewide report covers 2.7 million Oregonians. We report on 3,395 practicing PCPs within the state, and our database covers 78% of the fully insured commercial, Medicare, and Medicaid plans in the state. So it's a very large data set, and it gives us a pretty broad picture of what's going on in the clinics. One of the other things we do is we take this data and we report the quality utilization cost metrics to providers, health plans, and the public. We have created really innovative measures that and are piloting them in the state. And then we also do, with this large database, and custom reporting to various stakeholders. Lately, we've been focusing on alternative payment methodologies. So one of the things that Mylea, who is our executive director, calls a little-known secret is that Q-Corp is actually part of national network of collaboratives across the country. We belong to the Regional Healthcare Improvement Collaborative. What does it stand for? National Network of Regional Health Improvement Collaboratives. Thank you. Network of Regional Health Improvement Collaboratives. There's 35 organizations across the country. What that allows us to do as far as our measurement and reporting initiatives is we're able to share best practices and ideas with other organizations across the country who are doing similar work to us. And now we'll jump into talking about our measure of the day, which is chlamydia screening. One of the things when I was first asked to do this, to actually pick a measure and talk for half an hour about it, my first thought was, how in the world am I going to make that so it's interesting and engaging for everybody sitting on the other end of the phone? We really, in addition to giving you some information on this measure, we would really like it if you give us some feedback on some of the usefulness in the measure of your practice, some of the challenges you may face in getting people in there for their screenings, and just any other information that you think you could give us to help inform our work. One of the things that makes the chlamydia screening kind of a tough nut to crack is the stigma around STIs. It's probably the biggest barrier to improving screening rates. And what we're trying to have you go away from the session today is with an understanding of how the measure is calculated and how it should be used and why it's important. So important. Well, the measure actually measures the percentage of sexually active women between the ages of 16 and 24 who had a test for chlamydia infection within the reporting year. It's important because it is the most common reportable illness in Oregon. That is from data for 2014 produced by the Oregon Public Health Division. And the other thing is, if you look at the chart that's on the right-hand side of your screen, the chlamydia screening rates in Oregon are much lower than national benchmarks. The box at the top in the yellow is the HEDIS 90th percentile, and there is a gray diamond, which is the national average. The other thing is screening rates were lower than the national average. We've also slipped over time. If you compare what we reported for our June 2013 period to our June 2014 period for both commercial and Medicaid populations, the rate has slipped. So this part here that's in front of you now, another question that we get asked frequently is, why 16 to 24-year-olds? This chart was obtained from a CDC website. It shows the rates of reported chlamydia cases by age and sex in the U.S. for 2014. And if you look at the right-hand side of the chart, that is women, and the age bands that have the most frequent reports of chlamydia are ages 15 to 19 and ages 20 to 24. And that's what informed decision to measure that population. Chlamydia screening, what you should know. You should know that how the denominator is calculated. The denominator is supposed to be every woman who is sexually active between ages of 16 and 24. That is really difficult to get to using claims data, so we'll talk a little bit more on what proxies the HEDIS measure uses to try to get at that. There are now fewer opportunities for chlamydia screening in younger women, partly because of changing in guidelines for cervical cancer screenings. Also, we have the new law that went into effect in Oregon on January 1st that allows women over the age of 18 to get their birth control prescriptions directly from the pharmacy. That may limit opportunities for PCP and OBGYNs to actually get those women in the office to get screenings done. I already mentioned that Oregon's screening rate is well below national benchmark. And the other interesting thing about this measure is the Medicaid rate is better than the commercial rate, which when you look at most quality measures, you see the opposite thing, and a lot of that is challenges around access and getting people in. Chlamydia screening actually does better than commercial. All right. How does HEDIS define sexually active? Well, there is no code in the claims data system which actually says a person is sexually active. So it uses basically three things. One is if there's an evidence of pregnancy or pregnancy test, that's usually an indication that somebody's sexually active. There's an evidence of other sexually transmitted infections. They should also be getting their chlamydia screening. And then the last one, which is probably the most questioned, is whether the woman is using birth control, and it's found in the prescription data. The reason people question that is probably pretty obvious to people, is that birth control prescriptions are sometimes given to especially young women for reasons other than avoiding pregnancy. So, for example, a girl who has dysmenorrhea, she may be given a prescription of birth control, and she may not be sexually active, and there is no reason to screen her for chlamydia. On the flip side, not a sexually active young woman is using birth control, and so the measure may miss some people that should be getting their screening. According to the Guttmacher Institute, 10% of women who are at risk of unintended pregnancy are not using birth control. When you look at women that are 15 to 19 years old, that number rises up to 18%. And it could be argued that those young women who are at risk of pregnancy, who are not using birth control, may also be at higher risk of sexually transmitted infections. The assumption is, though, with these HEDIS measures, as imperfect as they are, is that it should be comparable across populations. So while the absolute number of sexually active women that may not be correct, if calculating the same measure for every single clinic and every single comparison group should be able to compare two groups. The other assumption is that when you look at trends over time, you're calculating the measure the same way, and if you see an upward or downward trend, even if you're not 100% confident in that absolute number, you can be confident that the trend is accurate. And that's probably true for most HEDIS measures. Mentioned earlier, there is some changes that have happened since this measure was first, when HEDIS established this measure to be tracked, that may be impacting rates. There are lost opportunities for chlamydia screenings. Cervical cancer screening is no longer recommended for women under the age of 21. That used to be an opportunity when people came into the office and got their screenings done to also do their chlamydia screening. And like I mentioned before, young over the age of 18 can now get their contraception directly from the pharmacist and have no incentive to go in and visit their provider for an exam. Oregon's is well below the national benchmark. In our recent statewide report that was produced by Quality Corps, we reported a rate of 42%. The national benchmark is actually 48.9, so that's an 8.9% discrepancy. Chart is another chart I obtained from the CDC, and what we in our own data is that the Medicaid rates for chlamydia screenings are higher than for the commercial population. This chart shows that this is actually a national phenomenon. This is national data from the CDC. The blue line is Medicaid, the red dashed line is commercial, and over time, even though rates have increased, Medicaid patients have a higher rate of screening than commercial screenings. And when we get to the part where we have some open floor time, we'd love to hear your thoughts on why that happens. So how do we improve this measure? This is your chance to kind of talk to us. We go to all this work of putting the data together and reporting it. Oregon has made some slight increases over time, but this last year there was a little dip, and that's a little discouraging. And so how might you interpret your performance, and we'd also like to know how we could make changes for the next measurement cycle.
So at this point, we'd like to open the floor for some feedback to answer some of these questions, or for you to ask us some questions There are a couple of ways you can do this. So, as you mentioned before, you can submit your questions into the question pane directly, the Q&A pane on the right side of your screen in WebEx, or to verbalize your question. Also on the right side of the screen, you look at participant list. Right underneath, there's a little hand icon, and you can raise that hand, click that, and we'll know that we should unmute you, and you can have a chance to verbalize your question. The floor is now open for your questions.
Would anybody be willing to share their thoughts on why they think the Medicaid population made during performance to the commercial population for this measure? Okay, another question that might spark some conversation is, what are things that can be done as a clinic level to address the stigma around chlamydia screenings?
Just everyone, haven't had a chance to have your coffee yet? I have you since the statewide reports have come out about this measure specifically, any questions from providers?
Not with this round of the statewide report. There have been no specific questions, but we have had questions in the past. Most of the questions have to do with the young age band. You know, some people perceive that as being too young. The data kind of contradicts that as far as the infection rates go. We've gotten once in a while is why they don't track older women, and because people older than the age of 24 can be at risk too. And the answer to that is they decided to focus on the age bands that's most at risk.
Have any questions about what to do with your data once you've received, how to move forward with making changes and improving your rates? Okay, continue to field questions through the end, and also Cindy's email is provided at the very end if you have other questions that you think up after this webinar. And again, this is the first in this series of Monday webinars, so we appreciate any feedback you might have about how to improve our presentation to make it more Thank you, everyone, for being on this morning. Now it's kind of early, and we appreciate you being with us for this first round. And thank you so much, Cindy, for providing your expertise. I do alert everyone to the next Metric Monday, which will be Monday, March 7th at 30, again, same time. This webinar will be talking about adolescent well kits. So that's just things. When we send out the link, or send out the slides, there will be a link to register here. But the registration is also open if you go to our website at www.q-corp.com. And finally, And finally, I just wanted to everyone also to the most recent statewide report that was published. Again, there'll be a link on this slide when we send it out, but it's also on our website at www.corp.org. And we're on for time. Great rest of your Monday.